The goal of this video is to help you get started on treating your urgency urinary incontinence. That needing to go all the time feeling, needing to rush get to the bathroom because you're afraid you're going to leak before you get there, or even leaking before you get there. So, with overactive bladder or urgency urinary incontinence, we talk about first line therapy, second line therapy, and third line therapy. First line therapy focuses on behavioral changes and pelvic floor strengthening. Second line therapy is medications and supplements. And then third line therapy includes procedures and surgeries. So in this video, I'm really focusing on first line therapy. For many women with overactive bladder, first line therapy is all they need to do to treat their urgency urinary incontinence. So, this is always the first thing that we recommend, and I'll include a list of resources at the end of this video to help you. This first line therapy takes a lot of work on your part, but that work can lead to great results. So it's an important thing for you to do. So to get started, you need to keep a bladder diary for a few days. You want to do this when your bladder is acting up. If you do it on a day when your bladder is behaving perfectly, you have to repeat it so that you can really see what's happening on your bad days. A bladder diary really involves journaling what you're drinking, what you're eating, and how your bladder is behaving. When we do this in the office and we have people keep a formal bladder diary, you actually measure the amount that you're emptying. But at home, you don't have to do this. You can use a formal bladder diary or you can just write it down on a piece of paper. And what you want to write down is you want to write down how often you're emptying, how often you're leaking, and when you're having urgency. So you're really documenting when you're having the problems that bother you. When you've done this for a few days, you want to look at your results. Can you see any patterns? Does your bladder act up after that second cup of coffee? Is it worse when you're drinking carbonated water? Do drinks with artificial sweeteners make it worse? Or maybe tomato based foods. So there are a lot of different triggers that can impact the bladder. And so you want to look at your diary to see if you can see any of those patterns. You're also going to add up the number of leaks that you're having per day. And you're going to add up the number of times that you're going to the bathroom. This will tell you about your symptoms at baseline. And as you change things, you can tell if you're actually getting better. And it's important to really look at this. A lot of the time, as you're getting better, it's hard to recognize your progress. So you need to look at this objective data. Then you want to review the list of bladder irritants with your bladder diary. Are you eating or drinking anything that might be making your symptoms worse? And once you identify something that might be impacting your bladder, you should eliminate it for a few days and then repeat your bladder diary to see if you have any improvements. I usually recommend removing one thing at a time. Some people like to remove all bladder irritants, but I think that's too hard for most of us. And once you identify your own list of bladder irritants, so the things that really bother you, you can use that information in the way that works for you. So you could eliminate that item completely from your diet, or let's say it's coffee. You could say, I'm going to drink coffee when I'm having a quiet day and I'm staying at home, and it's okay if my bladder acts up a little bit. But if I'm out and about, I'm going to eliminate coffee on those days. So you can use this information and fit it into your life in a way that works for you. Women with urgency urinary incontinence also need to have a strong pelvic floor, and pelvic floor strengthening also helps urgency incontinence. And again, these pelvic floor muscles are a little bit of a mystery to all of us. They go from hip to hip, from your pubic bone to your tailbone. They are shaped like a bowl and they hold up all of your organs and they're attached to your sphincters. To improve the strength of these muscles, you need to be able to do a pelvic floor contraction correctly. And if you're not sure that you're doing them correctly, then you need to double check with a provider or with a pelvic floor physical therapist. So there's good data with pelvic floor strengthening with the pelvic floor physical therapist that shows us that strengthening the pelvic floor works in about 70% of women with urgency urinary incontinence. And just like with stress incontinence, there's more and more data coming out showing that you can do this on your own as well. But again, this only works if you can do the contraction correctly and if you continue to do it for 3 to 6 months. Just like with stress urinary incontinence, you can do these exercises on your own. You could add in vaginal weights because the vaginal weights will help give you some biofeedback. You could get a peri trainer, which will give you exercise routines and help you strengthen the pelvic floor and monitor your progress. You could work out with an athletic trainer or with a PT online, or you could see a pelvic floor physical therapist in person. Urgency urinary incontinence is different than stress incontinence, and the number one technique that is recommended by physical therapists is called urge suppression. And urge suppression is what you really need to learn to minimize that urge and get rid of that feeling of needing to go. With urge suppression, you do 5 quick pelvic floor contractions the minute you feel an urge to go to the bathroom. So, contracting your pelvic floor like this reflexively tells your bladder to stop contracting and relax. And so it will make that bladder contraction go away and will make that feeling of urgency go away. While you're waiting for the urge to go away, you need to stand still and you need to take 5 deep breaths. And the way that I would tell you to do those breaths is to count to 4 while you inhale, hold your breath for a count of 2, and then exhale on a count of 8. And you want to do that 5 times. And while you're doing that, if you need to do something else to distract yourself, you should think of a positive, relaxing image. And then once you have done that breathing, you should feel like that urgency has gone away and you should be able to quietly walk to the bathroom. The stronger your pelvic floor is, the better this technique works. And urge suppression is one of the big things that we're working on for women with overactive bladder. The last technique that we recommend for overactive bladder is bladder retraining. And this slowly teaches your bladder to hold more over time and teaches you to ignore the feelings that your bladder is giving you. In this technique, you go to the bathroom based on time and not when you feel an urge. So you might start at emptying every 90 minutes. You're going to do this for 3 days. You're going to go to the bathroom every 90 minutes while you're awake, whether you feel an urge or not. You're not going to go to the bathroom at any other point in time. And then after those 3 days, you're going to increase that interval time by 30 minutes. So you would go from 90 minutes to 2 hours, right? So to 120 minutes. And then you're going to repeat that for 3 days. And then you're going to lengthen the interval again. And you're going to keep doing this until you get to the interval that works for you. So maybe 3 hours. And this retraining is very, very helpful for many women with overactive bladder. So these are the fundamentals that help many women with overactive bladder. This is the first line therapy. And women who go on to additional treatment always do better when they've mastered these techniques. So I would encourage you to start working on them and start strengthening your pelvic floor.